Hi parents, myself Anoop from Banja Luka, Bosnia. Today we have a special podcast, Dean Faculty of Medicine, University of Banja Luka. We'll be discussing all the possibilities and detailed information about MBBS in Bosnia, which other agents won't tell you. So I welcome our special guest, Professor Dr.Ranko Škrbić. Welcome, sir.
Nice meeting you.
Sir, before we start, can you tell us about your journey, about the education, being a dean, being involved in the student education, and about the university?
Yeah, I finished the School of Medicine here at the University of Banja Luka long time ago. That was in mid-80s. And soon after I got, after finished my internship of 1 year at the hospital and one community center, I got the opportunity to work here at the Department of Pharmacology at the School of Medicine. Okay. Actually, I was a brilliant student, and that was the reason why they recruited me. They invited me to come back to university. Soon after, I was offered by very interesting scholarship from Japan. That was the highest and the most prestigious scholarship called Mombusho from the Japanese government. And I went there for postgraduate education. In the meantime, I also finished the master thesis and postgraduate training, postgraduate master program at Zagreb University. It's in Croatia. At that time, it was Yugoslavia. Mm-hmm. And actually, in Japan, I accomplished my PhD thesis, which I defended in following years in mid-90s at the University of Belgrade. A couple of years later, I was almost the same year I was elected as assistant professor here at the Department of Pharmacology and Toxicology. And a few years later, I accomplished my education in clinical pharmacology at another university, which is in Serbia. So after that, I visited very many different places, like had a short training in pharmacoeconomics at London School of Economics in London, and also the training in pharmacoeconomics and pharmacoinformatics at Bristol University in the southwest of England. Yeah. So that was more or less works like that, being also very much involved in the teaching process here at university. In 2006, I was invited by the Prime Minister of the Republic of Srpska, which is one of the two entities in Bosnia and Herzegovina, to join the government and to form the cabinet of the Ministry of Health and Social Welfare. So I was appointed as a minister, and I served as a Minister of Health for 7 years until 2013. After that, I was engaged as ambassador of Bosnia and Herzegovina in Serbia for 2 years. And in 2015, after I accomplished the mission, being as a ambassador there, I turned back to university. And at that time, the current dean offered me a position to form to make a new format for PhD program, and what I did actually, and that was for that time was very modern PhD program for our postgraduates. And a year later, they offered me the position of dean, which I gladly accepted. And well, this is my third turn, if I can say, that I'm on the position of dean from 2016 and now 2026. And well, that was very challenging for me to use all my experience that I had before, being in academia, being in a government, in executive activities of the government as a minister, being in diplomacy for 2 years. So I use all this experience, and I put it into improvement and education and organization of the Faculty of Medicine, University of Banja Luka.
Yes,
that's in brief my journey that I had here.
I know you have been to India.
Yeah.
You have visited AIIMS Jodhpur.
Yeah.
And we have some collaborations.
Yeah.
Can you? Yeah.
Yeah. Thanks to actually in 2019 or even before, during the COVID time, we've been discussing how to start with the English program and to offer medicine in English for our foreign students. Unfortunately, the COVID made a kind of break in our attempts to accomplish that program. So soon after the COVID was over, we started with our English program, and that's how I met some people from India, and to start offering the English program in medicine for foreign students. And I'm very glad that majority of students, more than 60-70% of students, foreign students that apply for our program, medicine in English, are coming from India. So that was the reason why I was at that time offered to visit New Delhi. That was my first visit. Actually, it was my second visit to India. Long time ago, some 20 years ago, I visited India, New Delhi, and I was a guest of one of the pharmaceutical companies, because I'm a pharmacologist and always involved with the pharmaceutical sector. So that was Panesha Biotech, pharmaceutical producers with the headquarters in New Delhi. That was my first experience to be in India. And then, of course, a couple of years ago, I visited New Delhi, and that was a good opportunity for me to not only to learn more about India, but also to meet with health authorities from New Delhi in India, and we had very productive discussion. I was together with my deputies, my vice deans, and we had very productive discussion with AIMS authorities. So that time I learned more about the health system, and that the government in Delhi is trying to invest a lot of money and efforts to develop the AIMS centers throughout the country. So the second visit was 2 years later, that was in 2024, that I was invited to participate as a teacher in Jodhpur. That the Jodhpur authorities, they organized Indian section of International Academy of Cardiovascular Sciences. I have to say that I'm a member of that International Academy of Cardiovascular Science that was formed some 30 years ago by one of the well-known professors who is Indian origin. Professor Naranjan Dalla is a well-known professor of pharmacology and physiology, working particularly in cardiovascular sciences. That's how he was decorated by the Canadian authorities for very many different purposes and reasons, and he's one of the most decorated persons in medical field in Canada. And he offered me to be a member of International Academy of Cardiovascular Sciences, together with some other colleagues from the region. So, as a member of that academy, that was a good opportunity. They invited me, the Indian section of IACS, International Academy of Cardiovascular Sciences, invited me to the annual meeting that held in Jodhpur 2024. And that was the reason that I went to Jodhpur and to meet with the people from Jodhpur University. And actually, the AIMS also is a very prestigious institution in Jodhpur, like in other countries, other regions of India. So all these contacts are very important for not only for me personally, but also for our university, for our Faculty of Medicine, because using this platform, using this networking with these professors, we are now in position to have a very productive collaboration with very many Indian professors. One of those is Professor Devendra Agrawal, who is also Indian origin, but works at Pomona University in California, and is our visiting professor. Naranjan Dalla is our visiting professor too, and from time to time he comes to Banja Luka to give the lecture for our students, for our postgraduates, for our PhD students. So I could say that this collaboration with opening the door toward the Indian students was something very important for the Faculty of Medicine, and we actually now gained based on that collaboration with India.
Okay, doctor. How would you describe your overall teaching philosophy about medical education?
Well, interesting question. What I'm trying to do is, first of all, I like being with the students, and I have some special areas where I really enjoy being with students and trying to transfer my knowledge and my experience to my students, and to let them know not only about the medicine, not only about the drugs that we use in daily routine. I mean, they will use in daily routine once they become doctors, but also to give them some philosophy of the life and the importance of knowledge, which will be of extreme importance for their future work. And also, once they finish medical school, once they become doctors, then they will face with the daily routine life, with daily routine activities. They will meet the people. So, and I usually say, don't see your patients as objectives. So they're human beings. They have their own families. They have their own children. They have their own parents, relatives, people surrounding them. So try to understand their problems. It's not only that you finish the checkups and that you prescribe the drugs and say, well, that's all. Sometimes nice words, sometimes the empathy will help more than drug. And I'm trying to transfer these, let's say, emotional aspects, psychological aspects, which are very important, because doctor is not only the doctor that is curing by knife in a surgery or curing by tablets. Sometimes find the time to talk with your patient, find the time to understand their problems. Must be, usually it's like this, that there are some hidden agendas, hidden problems, hidden stories that are behind the problems they have, and they're trying to present it to you. If you don't have a time, then first of all you will lose the trust.
Medicine only will not help.
Medicine will not help. So that patient will close the door and will try to find another doctor who will spend more time with him, more time to discuss, more time to understand. But also from the teacher's point of view, I'm trying to make the medicine, which is sometimes difficult to understand, trying to find a way to present medicine on the most visible way. So, I mean, we can use all modern technologies. We can use, VR technology, whatever. But sometimes you have to use your own hand and try to write it on the dashboard and to explain on the most simple way. From time to time, the media call me to explain something, what is new in medicine, and I'm using the ordinary common words. I never use Latin or English words to explain the ordinary people something that is very difficult to understand.
To make it simple.
You should make it simple. Even to my students, I say, well, let's put it on the simplest way. And then on top of it, we can put some Latin words, we can put English words, we can use very sophisticated pathways that are beneath of what we see on the surface. So that's how I see that students like it very much, that they really enjoy in my lectures, and all my colleagues from the Department of Pharmacology more or less use the same approach. So I'm also convincing other colleagues from different cathedrals, different departments to use the same way of not only discussing but also describing the matter, and also trying to be on students' disposal whenever they need. So sometimes they knock on my doors asking for, let's say, simple questions about the organization. Because when we were preparing for the international program, I appeared on TV a couple of times. I said, well, guys, people from the city, tomorrow when you see the young girls and guys with a little bit different color of skin that we have here, don't think that there are some kind of immigrants or something like that. Try to understand that there are kids of some parents. That parents, they save some money to send them abroad to be trained and to get diploma.
Fulfill their dreams.
Of course, to fulfill their dreams. And can you imagine that you are sending your kids to India or to another place you never heard before, or to Europe or to the United States or to Russia or to China, doesn't matter. But try put to understand the position of that kids, position of that parents,
Yes.
that they want to send their kids to the children to study in abroad, to study in a country they know a little, to study in a place where everybody is looking with some suspicious. So let's put it on the way around.
Yeah, make it.
Let's make it more. So I think it's as you like to be well accepted in one community. Try to understand that also the kids are expecting to be well accepted in our community, and let's do it on our best possible way. And following this, after that, I appeared on TV. I met some of my neighbors, some of my colleagues. Said, "Well, we saw your students." Well, so when we saw them, we realized what you were talking about. So that kind of understanding is very important. So sometimes we have some, strange views on if particularly it's connected with less knowledge and with less empathy, then you have some kind of resistance. But now I think that we are all learning together and that we are all doing our best to make their life here in Banja Luka, which is very calm, very nice place, full of students, young people. And from time, after months spending here or years, they accommodate themselves and they found that the city itself is very welcoming for
They're becoming the part of the city and the culture.
Of course, that's it.
So, Doctor, what are the major international collaborations and academic partnerships does the university currently have to contribute to the growth and development of the international students?
Well, I'm very proud to say that we have collaboration with very many different faculties and universities, not only in the region. We have the contracts and collaboration with all major universities here in the region of former Yugoslavia, including Zagreb, Croatia, including Ljubljana, Slovenia, including Belgrade, Novi Sad, Kragujevac, and Niš from Serbia. So all around the surrounding region, particularly the universities from former Yugoslavia, we all speak same language. We are almost very similar. So that we have very good collaboration. So just to let you know, if you look at the map of the whole region, you will see that Banja Luka as a city is located in the middle of triangle, where the Zagreb is on the west, Sarajevo is on the south, and Belgrade is on the east. Okay. So we are in perfect center of that triangle. Okay. Trying to find our space under the sky between these three big universities. Okay. And I think that we are in a quite good position geographically, but also in relations with all these faculties. We have collaboration. That means that some professors from Zagreb, some professors from Belgrade comes to Banja Luka to give the lectures, so that we have that kind of exchange of ideas, knowledge, what is very important for our students, not only to listen our domestic faculty members and professors, but also to be in position and to experience the lectures from different universities outside. But also outside that region, we have a collaboration with the Vienna Medical University. Vienna Medical University is one of the biggest and closest to us. This is just 500 kilometers north from Banja Luka. It's, let's say, by car, it's roughly 5 hours by car, 5 to 6 hours. So, but there is also a flight from Banja Luka to Vienna. We are connected also with Belgrade and also with some other European cities. We also have a collaboration with some Hungarian universities from Hungary, but also universities from Russia, from St. Petersburg Medical University, first Moscow State Medical University from Moscow, Russia. Also collaboration with I already mentioned Medical University from Pomona, California. Okay. Collaboration with Shanghai Medical University in Shanghai and some other cities in China, and also almost ready to sign the contract with some universities from India. Okay. And we are very much interested and very much ready to establish this collaboration with the Indian universities. And I think that this basis and platform that we have and good experience having your students here is additional value and additional reason that we have to establish collaboration with some universities from India.
Okay, thank you, Doctor. So, in your opinion, what makes faculty of University of Banja Luka, we can compare about the Eastern European countries?
That's right.
And what is your opinion? And
well, I could say that Banja Luka University is compared to other universities in Europe on the world is a pretty young university. So the university itself celebrated last year the 50th anniversary.
okay.
So Faculty of Medicine was established in 1978. So that means that we are celebrating 48 anniversary this year. And also I could say that being a part of the former Yugoslavia, we are more or less similar to other universities, other faculties in the region. So very similar standards and very similar level of knowledge that we offer our students are comparable to the level of knowledge that is offered in Novi Sad University, Belgrade, or some other Zagreb or sub universities. So this kind of exchange will actually help us to give and to keep that standard. It's also important to mention that last year we got accreditation that we are accredited by WFME. The WFME is World Federation for Medical Education. Introducing and accepting the international standards are very important for the university. Yes. We applied to that audit, which was done by Budapest, that's Hungarian accreditation agency, and we spent almost all year last in 2025 preparing ourselves and for self-auditing, self-evaluation, and also for auditing from the members of the agency. And in November last year, that inspection came to Banja Luka, to our university. They spent 3 days, and after that, the report was very positive, and we got the accreditation for following 6 years. So that's very important. That gives us, the right to be, confident at the same time, and also to see
more opportunities to
more opportunity to see the level where we are and what the steps, which steps are needed to get on the higher level. So I think that we are on good way, and of course this international collaboration, the program, study program in English, and all these contacts with your colleagues, your friends, your people was very important for us, and I'm very, very thankful to that.
The National Medical Commission now mandates internships for the Indian students to their journey in the medicals.
Yeah.
How does University of Banja Luka plan to implement an internship program for our students?
I have to be honest that when I was a student, the internship program was quite common for us.
Yeah.
So after several changes, that at that time the program, medical program for medicine was a 5th-year program. So and the internship was the 6th year actually. Yeah. But we were doctors, and then we entered the internship program. And what was requested by your health authorities is something that was a little bit, strange for us. But at the same time, we realized, oh my God, that's the same what we had before. And I do understand the need for that internship program, which when we ask, okay, could you give me the program? What the authorities are expecting to? What are the fields? What are the norms that you request from us? That we have prepared at the program. So when we saw it, we said, well, that's more or less similar to what we had before. Okay. And it's nothing new for me. So I said, well, let's talk to other professors from the chiefs of the cathedrals. Okay. And they said, well, we can arrange it. I mean, no problem. Once they finish medical school, then they will be offered to stay in our health institutions. They can stay at our university clinical center, and they can stay at some other institutions. It's not only the secondary, tertiary care in teaching hospital that they have to learn things in medicine, but also there is a primary care in primary healthcare facilities. There are also some institutions that are not related to University Clinical Center. Mm-hmm. Okay, we are ready to offer it, and we have a lot of capacities. We have teaching hospitals, not only that one in the city, and when we proposed the program, of course, we first distributed the program that was requested by your health authorities. We distributed to our professors who are members of our council, and they said, "Well, that's acceptable. That's something that is very interesting, and we are very much ready to accept and to offer, the capacities for foreign students to spend additional year in practice." I mean, that will help, of course, the University Clinical Center staff. Okay. So they will have young doctors working in a field and working together with them.
This is a good practice.
And that will be good practice not only for students, but also good experience for our doctors that are already at the University Clinical Center in teaching or other teaching hospitals. So I think that was well accepted, and we voted for that easily. And I think that was, one of the decisions that were luckily accepted by our committee.
Okay, students used to tell about your style of lectures, and you are highly speaks in lectures. What is your opinion to make a lecture truly engaging in their education?
Well, I think the teacher, first of all, we are not talking about knowledge. We are not talking about the importance that you have to transfer knowledge to students. But we are talking about the style, how you perform it, and how you put yourself in their shoes. Yeah. So how you spend the time being with your students, and how you convince them that it's sometimes like in theater, like in that you have actors, that you have and to show them on the most acceptable way that what you are talking about. So you should make medicine visible, understandable, that everybody could understand, everybody can imagine or see by his or her own eyes the message that you send, and not only that, but also to remember. And to keep it in your memory, and to once you have it, to be able to reproduce and to be able to explain to others. If you don't achieve that, then your lecture is not acceptable.
They should not study and learn by heart.
They should understand. And I used to use a pen. I used to the dashboard to explain things on simplest way. I say, well, if I can describe or make drawings, you can do the same. But if you put it in a finger, in a hands, if you can repeat it by hands, then you will remember. Yeah. But if you just talk, the talk will pass through your ears and it will disappear. But sometimes we have to do our best to let you, not only to let you know, to let knowledge stay in you, that you understand, and that you are able to reproduce and to understand and to repeat and to explain to your colleagues.
Yes.
So if you can, the knowledge that you accepted from me, if you can reproduce and if you can explain to the daughter, to the son, to the grandmother, then it means that you understand.
Yeah.
If you are not able to do so, then you have to repeat. Yeah. And repeat until you understand it. So once you understand, then you're ready to. So the knowledge is not only that you have to use it for yourself. I mean, it's important for yourself. But the knowledge is something that, if you, for example, cut the apple into two, and I give one half to you and stay one half with me. So that means that you have a half, I have a half.
Yes.
But if you have a knowledge, and if I share the knowledge with you, so we have both the knowledge.
Yes, it can be shared.
It can be shared. So if we share, multiply the sharing, then the knowledge will increase. So that's the whole philosophy. Let's do it together. So that's why sometimes, not always, but sometimes teamwork is very important. But once you understand it by yourself, then put it in a club, put it in a team, and let's try to solve the problems together.
Yes, that's how you learn something new.
That's right.
And you learn, once you learn, you should not forget it. So we can share to anybody, and it will be.
That's right. But to be honest, whenever I have a time, I read some new, stuff, some new information, some new, publications, and whenever I see something that's happened every day, even before sleeping, before going to bathroom, or before I start my job, I look at some news. News is not news about what is going on. Of course, it's important, the public news, but also looking at the news, what is new and interesting in the area of science. And I found something interesting. I will share with all my colleagues, and they have to share with others. I say, well, this is something interesting. Yes. So we have to be informed that what's going on. If it's new vaccine, if it's new drug, if it's new mechanism of action, if it's a new disease or old disease with some new perspectives, the new diagnostic procedures, all this information are very important, because today everybody can access to the media. You use your telephone, you can find. Sometimes the patients even are more informed than doctors.
Yeah, they Google it.
They Google it. The problem is that they don't know how to differentiate between true and false. So that's our role, to say, well, okay, the Google is nice, but it's not the matter of trust.
Same symptoms and different diseases.
You can find all your symptoms that you have on Google, but it doesn't make sense.
Yes. So, Doctor, what proactive steps does the department take continuously to improve academic and clinical learning experience, but not only the local, for also our international students?
Yeah, we are using very many different approaches, and for example, these days I had a couple of meetings with my deputies, with my professors, and to see how to improve the teaching skills, how to offer better knowledge to our students, how to make medicine more attractive, how to improve the passing score and passing rate, how to recruit and get more students interested for the subjects. So it's not easy. You cannot learn it from books. It should be based with experience. We have to put additional efforts from our side. First of all, I said, well, I'm learning now more than before, and I'm being in position to solve some problems that we are facing with in daily routine activities with students, with staff, with international arena. So, trying to understand all these factors that influence the process, and to gain on it, to learn it, and to transfer it into something what is innovative for all of us, and that innovative things to put on a real context, saying, well, let's improve it on this way. For example, last year, some guys from the anatomy department came to me and say, well, we have something interesting, so we can develop the virtual anatomy. There are some guys that are very much experienced in IT, and they would offer collaboration. They could make the virtual anatomy. I said, okay, let's do it. How much it costs? And we invested money, and again, and they developed virtual anatomy. The students like it very much.
It's a big support.
That's big support. Or in collaboration with your people, they said, well, there is a special anatomy table that can be used for our students, not only for students, but also for residents, once they become interested for surgery or some other subject, neurology, neurosurgery, whatever. So let's innovate this process, and let's buy equipment that will help us in presenting all these things, simulators, for example. And then again, we discussed a couple of months ago that something what is needed for our faculty is simulation center. We are now hardly working on it to provide simulation center, and we already are on the way to provide some equipment. This morning I had a discussion in the government with the Prime Minister and ministers requesting some additional financial support to make additional space ready to be used for our students, to offer them better conditions, and to buy additional equipment that is needed. Books, electronic books, the teaching and reading rooms, and everything. So that's how we are trying to accomplish the request from students, and to at the same time to modernize and to make it flexible and exchangeable with other universities.
Yeah. Students, they oftenly mention the field trips. So can you tell about some stories with them?
That's a very interesting program. When I was a minister, even before, we developed so-called national drug program, national medicine program.
Okay.
And every country has a kind of national medicine program, how to provide sufficient quantity of drugs that are of the highest quality, proved by international studies or trials, whatever, and to offer it to the health system on acceptable way with a reasonable price that are safe and effective at the same time. So, and we developed the so-called national drug program, national medicine program. So that was 20 years ago. A few years later, I've been requested at that time by the faculty authorities to offer some kind of, let's say, why don't you offer interesting subjects that could be, used for is there something new in that field? I said, well, national health program, national medicine program would be something interesting. Let's offer our students to see how the drug is developed, how the drug is produced, how the drug is distributed. What is the role of wholesalers? What is the role of pharmacy? How the system is controlled? Who is responsible for controlling the system? What is the role? What is the pricing mechanisms? How to provide financials for how to make drugs available for majority of the people? How to make good selection of drugs that are needed, like, let's say, essential medicine program. Mm-hmm. That also exists in your country, in any country. So, and we got very good feedback from our students. So once we got the program in English, so they asked me, okay, do you have some elective subjects? I said, well, this could be interesting. One of my colleagues asked, but that's national program for our students, not for foreigners. I said, well, the national medicine program is same everywhere. Yeah. So let's offer them to visit the production site. So here in the city there is a quite big pharmaceutical producer, which is the member of Stada Group from Germany, and they produce the solid form of drugs, that means tablets and capsules, not only for this region but for the whole Europe. So that producer is Stada Hemopharm producer. They produce for the whole Europe and for Russia and some other countries. And so we, after the introduction lecture, we organize visit to that factory, which is not so far from the center of city. And then after that day, we offered students to go to Drug Regulatory Agency to see how the registration process for drugs works. Great. After that, next day they go to wholesaling companies to see how the distribution drugs. Then to pharmacy to see dispensation of drugs. Then they go to health insurance fund to see how they form the pricing, how they face with the pricing issue, how they provide sufficient number of drugs for hospitals and community pharmacies in order to be, prescriptions only, all over the counter or whatever. And then they visit the Public Health Institute to face with the vaccines and how the vaccines should be stored, delivered, what is the vaccination program for the country. And finally, they go to Ministry of Health, to the Department of Pharmacy within the Ministry of Health, which is responsible for creating the laws and the standards for the country. And I found it very, very attractive, very interesting. And I have more and more requests from students. For this year, for example, in these couple of weeks, I have to organize. I'm now faced with the trouble how to organize visit of 50 people. Now 50 people. It started with few of them, okay. And now they learn from each other that's something very interesting and that they can spend all week. So I have to now rearrange the activities and to split them into several groups and to kindly ask the pharmaceutical producer authorities to spare some time for several groups of students, because it's impossible to organize visits for 50 people to pass through clean rooms or to laboratories and everything. So, but I will do it. So that's interesting.
Yeah, I'm sure that these kind of opportunities and getting knowledge, they couldn't get from other universities. This kind of
that's something new, for example.
Yes.
And somebody asked me, well, but it's not related to patients. I said, not to one single patient, but the whole nation. So that's different. There's so many different patients.
Yes.
So I think the students should understand, once they have a drug, a medicine in their heads, once they use it to make a prescription, and showing prescription, say, well, you will take this drug. They should have a knowledge in behind how the drug is produced, how the drug is controlled, how the quality control assurance is done for that particular drug, how it's, what's the pathway, how the procedure from the molecule, from the tablet to the pharmacy. And not only it's not stopping at the pharmacy, it's going to the patient. So it's important that you have to convince your patient to taking drug in the morning, in the evening, or just at the noon, or one in the evening, so that's important. And what's the destiny of the drug in the body?
Yes.
How many times you have to use drug? Some drugs are used once a day, some are used twice a day, some are used once a week. We have now drugs for hyperlipidemia that have been used once in 6 months. That's new technology. Okay. Even before the patients used 3 times a day. Now they can use just once in 6 months. The one before was one in 1 month. So new technologies are important, and the students must know about that. Yeah. That instead of treating it this way, some patients should be treated this way.
Yes, not only the prescribing the medicine, they should know the journey behind.
Of course, everything. Yeah, that's it.
What is your long-term vision for our international students in Faculty of Medicine?
Well, we are interested to offer not only to have the program medicine in English, but also other study programs like dental medicine, like pharmacy, like nursing program. That's also very interesting for us, and I think that could be interesting for international students as well. And we are very much looking forward to. We are ready with some of these programs and ready to offer it as a program. I think that's very important, not only for the Faculty of Medicine, but also I explained to my colleagues, deans of other faculties at the university, that is also important for a university itself. Because as many students, foreign students, we come at different faculties, that the international arena will be more present here, and that can all faculties and university itself could improve the capacities and could be on a higher position at international arena. So I think that's something very important, and we are ready to offer that capacity. To be honest, these days we are discussing about how to offer better conditions and better facilities for our students. So when I was a Minister of Health, I had a couple of discussions at that time to some financial institutions, and we proposed the program to build up a new medical campus. And interestingly, this morning I had a meeting with our president and with members of the government, and we are very close to the decision to start the new medical campus that will be location on the close to University Clinical Center. So we would need 3.5 years to accomplish that huge project that is very costly, which will be a turnkey project, brand new facilities, brand new equipment, and then we will enrich our capacities, that we'll get better capacities for not only for domestic but also for international students. And that's one of the major challenges right now we have, and major projects that we have in the pipeline. And hopefully within a couple of months the government will make the final decision, and that will get the contractor that will be responsible to start with the new campus.
So, Doctor, there are many students who are interested to study MBBS abroad. So what is your clear message or advice to our parents and the students who wish to pursue their medicine abroad?
Well, first of all, to say that we are very open for international students, that we are very much interested to get students from India, and that we have conditions and capacities to offer very nice study program for students from India. Also, to mention that the Banja Luka city is not so big city. It's not like other cities with 1 million or 2 million people. We are rather small city, but with very nice people, with nice
Safest environment.
very safe compared to other European cities, and that people is here in Banja Luka is very warm. The city itself is very green, and there are a lot of young students, not only from in medicine, but also Banja Luka is university city. We have more than 15, 16, 17,000 students of different faculties. So Banja Luka is known as considered as a city of youth, city of green, city of festivals and cultures, and they really could enjoy to mix with our students, with international students, and to enjoy life in Banja Luka.
Let me take a chance to thank you for your valuable information. I think this podcast will help our parents and students to choose their MBBS wisely, and the country, the university. Thank you for your time.
Thank you for your time. Thank you.
Thank you.